everyone, today we are going to cover cholelithiasis or gallstones. So let's begin. So cholelithiasis means the presence of stones in the gallbladder. So it's incredibly common, about 10 to 20% of American adults, they have gallstones. So most people are asymptomatic. So they don't know they have them because they're not having any symptoms. So who's at risk? So we have 4 F's: female, 40, fertile, and fat. Also pregnancy, rapid weight loss, and certain medications increases risk. So there are 3 types of gallstones: pigmented stones, mixed stones, and cholesterol stones. So the most common is cholesterol stones, so it's about 80%. So these forms when bile has too much cholesterol, and they usually are yellow and green. So you can observe yellow and green gallstones. So pigmented stones come in 2 types: black stones and brown stones. So the black stones form from hemolysis, like in sickle cell anemia, sickle cell disease, and brown stones are associated with biliary infections. However, the mixed stones contain both cholesterol and pigment. So most patients are presenting asymptomatic. So we find gallstones incidentally on imaging for other reasons. So when stones cause symptoms, we call it biliary colic, and this is postprandial right upper quadrant pain, and meaning it happens after eating, especially fatty meals. The pain is severe and it is usually constant and lasts 30 minutes to several hours and may radiate to the right shoulder or back. So patients often have nausea or vomiting too. So diagnosis is straightforward. So ultrasound is the best initial test. So it's cheap and non-invasive, and it's highly sensitive. So on ultrasound we see echogenic structures in the gallbladder that cast acoustic shadows. So management depends on symptoms. So asymptomatic gallstones, in this case we just observe and there's no treatment needed. So most will never cause problem. So symptomatic gallstones with biliary colic, that's an indication for surgery. So laparoscopic cholecystectomy is the definitive treatment. So we remove the entire gallbladder, and it's typically done electively, but if complications develop, like acute cholecystitis or cholangitis or even pancreatitis, surgery becomes more urgent. So that's it for cholelithiasis. So remember, common and it is usually common and silent, and cholesterol stones are most frequent, and biliary colic after fatty meals, and ultrasound for the diagnosis, and cholecystectomy for symptomatic disease. So if you find this useful, like, subscribe, and share it with your friends for